afternoon. Professor Mosa Moshabela is an Associate Professor and Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor of Public Health. Professor, good afternoon to you. You've been watching that. We've been seeing some projections now of what a fourth wave would look like. Do you agree with that idea, that the peak number of hospitalizations wouldn't be as bad as the first, second and third waves?
Greetings, Stephen, and to the viewers. I think the data that we received today, it's very much welcome news because we've been waiting for it for a while. And clearly, I think that they've done quite a lot of work and put a lot of thought into these projections. They have accounted for quite a number of factors that could affect the infections. And just to say that they've accounted for possible behavior change, they've accounted for possible restrictions or alert levels, they've accounted for variants of concern or variants of interest, they've accounted for severe disease, they've accounted for past infection or past immunity from past infection. They've accounted for a number of things, Stephen, and as a result, I think the complex approach that they've taken really makes the model respectable, and I'm very much happy to welcome what they've presented, that the projections by all means, taking into account vaccinations as well, that we may have a lower peak for the third wave in terms of hospitalization.
It seems that everyone I've heard from says that they do expect a fourth wave. I think you may too, and if that is the case, there is still the chance that we could lose many more people due to this disease, which then immediately takes us to the conversation around the vaccination rate.
Yeah, so Stephen, I think that what we are seeing in the projections is they have to take into account where we are in vaccinations. With the lower levels of vaccinations, then we will see more hospitalizations and death than if we had higher levels of vaccinations, whereby we will see less hospitalization, severe disease, and less death. So the model really, that's why it's saying that earlier fourth wave would result in slightly more deaths than if we were to see it in the later stages where vaccination will already be high. In all of that, I think that the message is clear, is that higher levels of vaccinations and higher levels of vaccination coverage are good for us. And I must also add that their models looks at hospitalization, severe disease, and death. It does not necessarily account for mild cases. So they're saying that in as much as we can see higher levels of mild cases, but what's important is with high levels of vaccinations and immunity in the population, we are still likely to see lower cases of hospitalization and death.
So, I mean, what this really boils down to is that it is actually possible, I suppose, to stop a fourth wave, not of the virus, but of hospitalizations and death. If we vaccinated 95% of our people, we'd be able to do that.
Yeah, so I think that they are saying that vaccination is important, but also behavior of people in terms of levels of contact. The more contact we have, if we abandon the prevention measures, then we increase the risk of vaccination not being as useful as it can be. But if we combine vaccination with prevention measures and the precautions, then we will see less hospitalization and death. And on top of that, they are saying that if we don't get a variant of concern that might perhaps end up escaping immunity. If it escapes immunity, it means that the vaccination will not offer as much protection as it is meant to protect us. Then we might actually see a little bit more hospitalization and death. So in all of that, I think that the point is to say that let's increase vaccination beyond 70%, but also let's continue to take prevention measures seriously. Let's not abandon prevention measures. And finally, let's pray that we don't get a kind of variant that will escape immunity.
How important is the timing of the start of a fourth wave to all of this? The earlier it starts, the lower the percentage of people who've been vaccinated, the higher the risk to a greater number of people. The later it starts, I presume, well, the better, the easier it would be for us.
Yeah. So I think there are two things there also. I think the earlier it starts, if it starts this year, and therefore, which means that the festive season becomes a vehicle for transmission, then it's bad news for us. But if we have, for example, a variant that is introduced later and the fourth wave starts later in January, then it means that we can comfortably implement prevention measures without interfering with much of what is expected during the festive season. So I think that's sort of what happened with the second wave. With the second wave, we introduced restrictions towards the end of the festive season, and a lot of provinces kind of survived, including Gauteng. But if we see a situation where the infection is spreading during a high peak season like December, then we have a problem.
Within all of that, then, I mean, are you surprised that this sort of wave didn't start during the local government elections? There have been some concerns that they would.
No, I'm not surprised. I think that we just saw a slight increase in cases, but I'm not sure that it will hold in terms of triggering the fourth wave, because one of the things that they pointed out is the fact that if you take into account both vaccination as well as immunity from past infection, you're looking at about 60 to 70% of immunity in the population, what they call seroprevalence. So if you take that into account and you consider the fact that, we didn't really have a new variant, for example, that was running amok, then you can consider the possibility that we were a little bit lucky to escape infection, even though we had high activity, which is also why they are saying that if we get into December with higher levels of immunity and without a variant that is serious, then we might still escape. But it's important not to abandon the protective measures, your masks and other things.
Professor Mosa Moshabela, as always, really appreciate the time. Thanks very much indeed. At the University of KwaZulu-Natal, Professor of Public Health there, Acting Vice Chancellor for Research and Innovation as well.